Hey everybody, this is Josh Miller here with Rudy Shrier. We're here to talk to you today about what you as a family should expect from your treatment team. Or better yet, the more accurate title of this talk might be what you need from your treatment team. A little bit about me. I'm the Director of Business Development at Red Rock Recovery Center in Denver, Colorado. I've worked specifically with young adults and their families in the recovery and long-term aftercare space since 2012. And I'm happy to be here with you today with my esteemed colleague, Mr. Rudy Shrier. Please introduce yourself.
And I work hand in hand with Josh as the families begin to progress with their loved one being in treatment with us. I have been working in this industry for a little over a decade at this point. I have a master's degree in counseling psychology. I am an EMDR certified therapist. I am a certified clinical trauma professional and a whole bunch of other letters that really don't mean a lot besides the fact that I've had a lot of training and learned a lot of skills from people much wiser than I am to help guide you and give you an opportunity for your own healing.
Thanks, Rudy. And I also just want to thank the families for watching and enjoying this video, despite the fact that Rudy and I could not record it in person together, despite working in the same building. I tend to be a little bit of a road warrior, and we're going to do the best we can remote. But I do think what we have to talk about today is can be really helpful to you. So we mentioned that the title of the talk is What to Expect, or maybe we should have titled it, What Do Families Need from Their Treatment Team? I often make the joke, the thing that families want the most from their treatment team is often communication. And, that makes total sense because of what they've been through and what's going on, and they're concerned about their loved one. And I make the joke about it. It is not to slight any of the families. It's just what they want the most, that just communication, to know what's going on, to try to alleviate some of their own fear, is actually maybe not their greatest need. And to address those needs, hopefully your team or your support system is going to do something about that. Rudy, what would you say, in your words, what is the greatest need of families affected by substance use disorder?
So one of the key things we're talking about here is the difference between a family's needs versus a family wants.
Right.
Traditionally, the family wants that communication. They want to hear as much as they can in an attempt to be able to go back to that place of control.
Yeah.
Where my desire for the families is closer to the concept of healing, moving away from the past place of fear that keeps people so stuck and repeating the same patterns. So it could be simply described as being able to have the phone ring in the middle of the night and not have a panic attack. Yeah. It could be getting a phone call from the treatment center, and when that phone rings and you see the caller ID, not needing to freak out because you know that you're taking care of you.
Absolutely. Yeah, I love that, man. When I talk to families about it, like if I'm talking about what you're going to do with them, right? Like I will generally phrase it as, hey, we want to see your peace and serenity and quality of life not be completely directly correlated with the immediate status of even just your opinion of your loved one's recovery. Because generally it's such a traumatic process or experience watching someone you care about go through substance use, addiction, that just your idea of where that person is and what they're doing can really start to run your life. Mm-hmm. And as much as our team's going to work our butts off to help your loved one, what we think is important, and for families of our program and across the globe for that matter, is that that not be the case for your quality of life. That's too fragile, and it's not a way to live. All right, Rudy, it's your time to shine. I want, systematically as much as possible for you to just lay out how do we help families move towards this place of healing, right? Like, I think it's a good idea. Like, no family, if you talk about them, experiencing their own healing, no family is like, well, we don't want that. But I think more often than not, it kind of seems like an abstract concept. And so what we'd like to do for you families watching is just to give a general outline of what a path towards that might look like.
So traditionally, there's two different phases that I like to look at. There's the primary healing and there's secondary healing. Secondary healing is all the people for everyone else around you. So in this scenario, I'm going to be talking about you as the loved one, as the primary client.
Right.
You're going to probably need possibly an interventionist to get your loved one into treatment. There will eventually probably need to be at some level of a treatment center, whether it be detox, residential, PHP, IOP, or outpatient. And your loved one will need their own therapist at some point. These are all the moving pieces that you can't control that are other people's work that they're doing.
Yeah.
The work for you as an individual is the primary healing. So that includes things like finding your own primary therapist to be able to talk and process your way through, for some families, what it's been like to Narcan a loved one on the floor of the bathroom Christmas morning.
Yeah.
That therapist can help guide you, maybe just some peer support, because it's nice to have a therapist, but it's even better to have friends that care and friends that have been through it.
Yeah.
Unfortunately, sometimes having friends who have been through it means you have some friends that also share some communal trauma. This can be good and this can be bad. It can build those links and the bonds with members of the community that allow you to feel further connected, that allows the vulnerability level to be much higher than it could be maybe with your brother-in-law.
Right.
Where you can have this commonality of not just the trauma you've been through, but also language. Because when you go into these support groups, you'll learn different styles of language that pull people in. You'll learn a little bit about how to have better assertive communication skills. If you're having very passive ways that it's allowing people to walk all over you, you're going to be challenged to really be a stronger individual and to take some ownership of that. In my mind, the biggest healing is when you don't even notice it. So those are moments where you've been doing your own therapy. You look at yourself in the mirror and you're begging to know that you're fixed, you're better, that things have changed, and you don't feel it. And you go to your peer support group and you're wanting someone to paint this picture and to look at you and go, wow, Rudy, where did you grow this long, luxurious blonde hair from? Something big has changed. Something big. But it's that moment where someone calls you and they say, hey, my treatment center is, what's the best one I hear? Oh, my treatment center hasn't fed me in 2 weeks. Some large scale, grandiose manipulation. And you pick up the phone and you hear this and you say, yeah, why don't you call me when your therapist is present and we can discuss it better at that point. But I just don't feel like engaging with you if you're not going to be able to be honest with me. And all of a sudden you hang up the phone and you realize this is the first time that you've created a healthy boundary.
Yeah.
That you've identified that this behavior will no longer be tolerated. And you didn't have to be angry. You didn't have to get volatile or loud. You just simply stated your truth. And those are the moments that you really begin to see the healing. Not when it's in a therapist's office or sitting in your Al-Anon meeting or your Thrive meeting or your Nar-Anon meeting. It's moments when you deal with normal life and you don't have that massive abreaction that you've become kind of used to.
Yeah, and that's, I like the situation you just described because it is a good example of what, a still loving and engaged, in this case, parent, might say in that situation. But generally, there absolutely is work needed to be done to get there. I've worked with families for a long time, and I've always seen, or often seen, I should say, that when we're traumatized, and this is not just families of substance use disorder, like we tend to, when that wound gets reactivated, right, we react in one form of an extreme.
Mm-hmm.
So with families, often it's either complete, enmeshment, like you might have one parent react to, like a fully enmeshed parent or loved one might react to that same situation and call the entire treatment team and ask, hey, why hasn't my son been fed in 2 weeks, and really get totally pulled into that situation. Mm-hmm. And again, this is understandable. Families, we are not shaming you. Quite the opposite, right?
This is expectation.
Yes.
And so I want to paint this picture that, I commonly use the PTSD model to explain to families what I expect from them. And I expect it to be really tough.
Yeah.
I expect it to be difficult. And I think it's important for us not to talk about, like you're saying, this isn't a shame-based conversation. This is an expectation. It is one of the most difficult things to let your loved one go away to treatment, because from a realistic perspective, your behavior has kept them alive until this point.
Mm-hmm.
And the hard thing is you become so accustomed and used to rescuing and saving and keeping them alive that we take this away. And sometimes families have this void. They don't know what to do when this loved one is taken out.
Yeah, I mean, absolutely. I think it's so easy for any of us, especially with people we love, to just continue to act in that way that was kind of keeping the situation just however tenable it was. Mm-hmm. The other reaction is the other extreme, right? Is the maybe, let's call it dad in this situation, but it could be anybody, that hears the same story and, says something, out of anger to his kid and just doesn't even want to talk to him or engage what's going on, which is really the person that he loves and is afraid for. They're uncomfortable because they're newly sober and are, addressing all this inner stuff, the causes and conditions of why we use, and they're trying to get out of it. They don't have their drug of choice. And so the next easiest thing is, well, just leave treatment. I can just kind of cut and run. And that reaction that you described of the family member who's done some work, it is hard to get to, but it is so important. And that's where we usually see healing, is we start to act as a more balanced person, right? There was an intersection of truth and love. It was, it's, hey, I love you. That doesn't sound like even the worst treatment center, didn't feed you for 2 weeks. Like, why don't you call me, when you're with your therapist and we can talk about this. Like that is a great, I think, visual, or not visual, a picture of what it would look like, because those words are incredible. What's even better there is that parent, even if they were a little triggered by it, what they actually did is self-regulate, like pause, and like react in a different way, and they're going to get a really different result, and they're actually going to really contribute in a meaningful way to their loved one's progress, which is really which I think all of our loved ones that try to be involved in whatever capacity want, right?
And in the world of trauma, we call that the zone of tolerance.
Yeah.
It's this magical area between the hyperarousal, which is maybe angry dad or mom having a panic attack, or any number of these large reactions. And the opposite side of that is the numbing, the almost disassociativeness of it, where it's just hard to feel anything. It's hard to find that energy. And when those moments happen, you just kind of float away and not really notice. Which is, again, expectation. I don't want to paint this that you're going to have to fall in one of these extreme sides of it.
Yeah.
but you're going to fall somewhere between these three. You're either going to fall into the zone of tolerance where you're able to pause in that moment and gauge your skills. You might be hyper aroused, you might be a little disassociative. And if you fall into one of those, the outside two, it validates the importance of your own care and you finding your own healing to get into that zone of tolerance. Because while we're talking about your personal life, it affects every aspect. Your professional life, all of your friends, external family members. And part of what I want for you is your healing. Away from your loved one, whether they do great or not, I want you to find an opportunity to heal.
Yeah. So Rudy, you mentioned that they'll need to, find their own therapist that's supporting them, that's hopefully will even connect them with more resources like, peer support groups, whether it be Al-Anon or there's actually quite a growing list of non-Al-Anon peer support groups out there that are really beneficial.
I'm imagining scrolling credits going by the side, just up and down. At this point in time, across the nation, you can find small peer support groups that are based locally and regionally. There's a lot of online resources that are spreading around the world. And off the top of my head, there's like 6 or 7 that I refer to a lot. Find a home that makes you feel welcome, that talks about a solution.
Yeah. The title of this talk is what to expect from your team, right? And if there's any families out there watching, if I was them, I might be questioning at this point, okay, you guys haven't addressed that at all. You've told me about some outside resources, but there's a reason for that. We're going to get to specific treatment teams and what you can expect and might need there. But would you talk a little bit about why, even with the greatest treatment program in the world, there's the need for additional resources like that personal therapist? Would you talk about that a little bit?
Your loved one going into treatment, their primary support can't be yours also.
Yeah.
And I think that if we just go into a simple cut and dry of why will this treatment center not be able to provide everything, it's because of that. This needs to be your loved one's treatment, not yours. They can help put you in touch with resources. They can help feed you some resources. I don't want to paint with broad strokes, but if there's no family program available whatsoever, you can reach out to me. And usually there's different family programs around that'll help with some psychoeducation or teach you a little bit. Most treatment centers in this day and age have at least a weekend intensive or some form of a program. I like to think of it as like emotional recovery boot camp.
Yeah.
You have 2 or 3 days with really, really, really serious groups that mainly try to educate you, kind of moving away from the idea that, addiction is a shame-based disease. No, addiction is a medically based disease. It's a disease of the brain that affects both behavior, cognition, and the way a person thinks.
Yeah.
And so you're also looking at kind of a one-size-fits-all program. So if you go into a family program, they're going to be teaching not just you. They'll be teaching every other family that might have traveled from across the United States with a desire to just ever so slightly better understand their loved one's struggle. And so as they pick up this information, they're going to speak to the crowd and the audience. Your loved one's therapist, while they're at treatment, will likely be checking in with you at least once a week.
Yeah.
However, depending upon how they check in, sometimes this is great. Sometimes, as a family member, we want to know details. I want to know what to expect when they come home. I want to know who's getting taken out of their phone. I want details. And the truth is, for me, details don't help me. Details enmesh me further and make me want more answers. So I get one answer, I have 2 more questions now. And so a lot of times, being able to time limit your contact with your loved one's therapist can be really, really helpful. When I contact families, I dedicate 5 minutes to talking about the person in treatment. The rest of the phone call is always going to be trying to focus on the family and identify how the family's doing, what resources are helping, what resources aren't working, and where we can increase the motivation to continue the loved one's care.
For sure.
I do like the idea of the family intensive as an opportunity to start finding other families who are going through similar struggles. So if you have a hard time maybe going alone to your first Al-Anon, Thrive, Nar-Anon, Narc-Anon, all these other meetings, if you have a hard time going alone, you may be able to meet a friend in one of these family intensives, someone who outside of that treatment milieu can become a part of your world, and that you can start engaging in your emotional recovery together.
Right.
I don't think you'll ever truly be able to understand as a loved one or a family member that doesn't have a substance use disorder what it can be like. But what I do believe you can learn through psychoeducation, whether it be through your therapist, through a family program, is that you can learn better communication skills, what it's like to move away from I statements and opposite, what it's like to move away from you statements and use I statements.
Yeah.
It moves away from a place of judgment and shame and becomes more welcoming and encompassing.
Yeah.
We can talk about holding boundaries, because many families I talk to are at the point where they don't even know how to hold a boundary anymore, because they've been walked over time and time again and mistrusted, abused, not treated like a family should. I think that it can teach you how to support others in your life, not just people in recovery, but how to support an employee that had a bad week, how to lift them up and help them get back to the performance level that you're used to.
Yeah.
And I think that my favorite thing about any form of therapy or emotional recovery is I think it's really great to connect with yourself, to be able to put a little bit of humility up and step away from the idea that I have to be perfect, and that I can accept that I am a broken and flawed individual and I make mistakes. And when I make a mistake, I have the blessings in my life that I'm able to make amends. I'm able to apologize. I'm able to pull people in that I might have wronged in a small and mindless way, because I've learned who I am.
Yeah.
I also like to challenge the families that, like, as they're finding this care, that your time commitment should be completely independent from your loved one. If your loved one says, well, I'll go to a detox for 4 days. Okay, you can go to detox for 4 days. I'm going to work on me. And that might mean a month. That might mean a year. That might mean I'm going to work on myself for the rest of my life to be the best version of me possible. Most people don't work on themselves the rest of their life. There comes a point in time where you continue to take care of yourself with self-care, mindfulness, and engagement. But no matter whether your loved one wants to continue working on themselves or they just want to wash their hands of it and walk away, I challenge you. Make you the priority. The more you can be the priority, the more you can set an example of what emotional recovery can look like in life.
For sure. So, yeah, I think because I think we'll just end up talking about the same thing for the entire time because we're passionate about this stuff. But just to summarize for the families watching and listening, no matter how great a treatment program is or how frequently they communicate with you or going to communicate with you or supposed to, I think Rudy and I want to really challenge you from our experience for what we see families needing is that you will need your own support team ancillary to that. And it's usually going to include at least a therapist and a peer support group. Your loved one could leave treatment, right? Does your treatment stop? It shouldn't, is what we're saying. Those two things aren't going to be directly correlated. If you want to help your loved one, we truly believe, and it's the reason for this video, that the greatest thing you can do for them is also the greatest thing that you can actually do for yourself. And that's to work on yourself, to engage in your own recovery and your own healing, to get clarity and awareness and skills and even more so peace and tranquility back in your life. But that really is the greatest thing that families can do. And what you were just saying, Rudy, I think leads really well into our next point, which is, and this is a question I get from families all the time about their loved one, and so I would think they if they're starting to look at their own journey, they're going to have the same question, even more so, is how long is this going to take, right? Like, I know I'm usually talking to a family who is at the beginning of this journey if they're talking, their loved one going off to treatment for 30, 60, or 90 days, and you can hear an expectation, something about them being fixed when that's over, right? That it's a go in, like triage, you get surgery, you put the cast on and you come back home. And that's really not an accurate, or I would say a good expectation of what treatment from substance use disorder looks like. Everything we know about the disease and recovery says this is a long haul. Mm-hmm. The longer you can stay connected to services and support, your chances for long-term recovery get better and better and better. And we just know from our experience that this takes a long time. I'm a person in long-term recovery. I'm still doing things that are correlated to my recovery work on a daily basis. That doesn't mean I'm struggling with drugs and alcohol or the desire to use those anymore, but I'm certainly still addressing the underlying causes of conditions of why I used to use. And families, what I would say to you is it's going to be the same. And that's not to scare you at all. Quite the opposite. The journey of recovery can very quickly, and this is for you and your loved one, and maybe even you sooner if you really engage, it can go from chore and frightening, right? Like I've got to do something I'm uncomfortable with and I don't like this, to massively rewarding and life-giving, right? Like the work you can do with your therapist and with your peer support group, it isn't just, mending some fences that have been torn down in the destruction of addiction, but it really is building, in a lot of times, new pathologies, new ways of thinking, new ways of assessing and doing life with those that we love, that is really life-giving and actually just massively beneficial and enjoyable. Mm-hmm. So when I tell you you're in for the long haul, that's not to scare you, but it is, I want to challenge you families that this will take a long time for your loved one to set that expectation and just be okay with it. It's not a bad thing that this is a lifelong healing process. And it's not a bad thing that it's going to be long-term for you. This is a good journey that we're inviting you on. Despite how it feels right now, it really can be a beautiful journey. But it is a long one. And I don't think there's any getting around that. Would you agree, Rudy?
I had this conversation with a young man who's been sober for about 7 days this morning in a group. And he identified this is going to be a lifelong journey for me and my family. I have to wake up every morning and take care of me and stop making everyone else in the world a priority until I implode on myself yet again. Yeah. The analogy I usually give clients is kind of similar to the one I do for families. I simply look these young men and women in the eye and I say, how long have you been in active addiction? How long did you walk into the woods of substance abuse? Usually my answer comes somewhere between 3 and 7, 10, 15 years. If you walk into the woods 2 hours, you get tired, you get thirsty, you turn around, you want to come back to the car and you want to grab a water bottle, and you get 15 minutes in, you want to give up, you got a little bit to go before the miracle happens. Yeah. You can't expect in 2 days for a miracle to occur that's been slowly grinding for years. Yeah. There's going to be really, really great moments, especially in those first 6 months, where things begin to find bright and shiny little moments. But just like recovery, family recovery and emotional recovery is not always a linear journey. Yeah. There are moments of setback. There are moments of trial and tribulation. but it's what the purpose is that makes it so wonderful. The purpose of the work that you have ahead of you, or the work that you're already engaging in for many of you, is simply that of happiness and joy and love. It's what I think it's about.
Absolutely. Absolutely. Well, Rudy, against maybe my wishes, has asked me to share a little with you about my own story, because I think, really it relates to what we're talking about. Good deal to do with my passion around it, around this topic, and so yeah, I want to share that with you. I mentioned earlier that I am a person in long-term recovery. I actually don't know if that's how my mother would describe herself, but I would describe my mother as also a person, a family member in long-term recovery. And I just real briefly wanted to give a snapshot of, because I think there's some lessons in there for families out there. And don't worry, my mom, should she ever see this, has endorsed this message, and would certainly support my take on things, and I think could even offer some valuable insight. But she's not here today, so I'll tell the story. The background is that I grew up in what most would consider very loving, supportive, whole family unit. So no glaring, family discord. Now, granted, we weren't perfect, just like anybody, but there's not some glaring thing, I think, that you can point to go, oh, well, this makes a lot of sense, why X happened in Josh's life, or, and I think that's important to know, because, I also have friends that have those traumas in their life that ended up nowhere near, the level of addiction that I did. So, and when I started to struggle, their response was, I would say, very positive. And I think that's important too. Like, it wasn't, we can't believe this. I wasn't, shamed or ridiculed. It was with support. I was 22 at the time, I think, when my journey started. I'm about 36 now. And, I, in a moment of just sheer freaking out, knew I had a problem, asked my parents for help, and man, they showed up. Literally, they showed up. I was living in Dallas. They were across the country. They drove to Dallas, and they said, hey, we're going to help you. We're going to get you the support that you need. Now, this conversation happened at dinner. We were talking about me having a problem with pain pills. I could probably be a poster boy for the opioid epidemic. Meanwhile, we were tossing back, 3 bottles of wine at dinner. And this isn't, I say that with a smile because of my experience in recovery, but it just, at the time, none of us knew that could even be an issue, right? Like, the alcohol wasn't even a consideration. At least it was being discussed. It was, okay, there's a pain pill problem. What do we do? And I think a lot of times, like a lot of families' reactions, was, okay, we'll get you a therapist. And not that would have been a bad plan. It was just, I think, a lot of times we tend to try to minimize in our own minds. And I think families can do that too. And so we want to maybe try an easier, softer way first. Not that just a therapist is a bad place to start. But if there's willingness to get help and, glaring substance abuse addiction, like, I would urge families maybe to take more significant action than that. But that night, after more wine, I flipped my car 6 times on I-35 in south of Dallas. And that was scary enough for all of us to get me to treatment. I kind of wavered on that. I remember one day, and my parents, they had talked to a counselor, and they said, no, you've said you need help. This really scared us. You're going to treatment. And I did. At our first family weekend, that first treatment of mine, my parents also showed up. They had been supportive the whole time. They had been kind. I had been engaging in group. I wanted some recovery, maybe very much so on my own terms, I think, early on. But I did want change. I think that's important to know. This wasn't like I was forced there and completely combative. Quite the opposite. That first family weekend, the treatment team presented me with an aftercare plan and suggested that I do sober living and maybe some continued outpatient and maybe a bit of a relocation for a while. And, my parents looked at me and said, well, are you willing to do that? And I said, no. I appreciate what was offered by the professional team, the recommendation, but I still have a job in Dallas and I need to get back to my life. And that's what will be good for me. And I believed that. Mm-hmm. This wasn't a grandiose manipulation to get back to my drug dealer or something like that. I believed what I was saying. And here's the next important piece that I think can be confusing is that my parents believed me, and of no fault of their own, right? They saw their son again, clean and sober, cleaned up, seemingly, thinking rationally, and of course it made sense for them to go, okay, they saw that I wanted it. They saw that I looked better and was clear-headed, and so they assumed that they could listen to what I was saying and trust it. But here's the hard thing that I think my mom would tell you now is that I didn't know what was best for me, and my parents didn't know what was best for me. That is a hard part of navigating this issue of accessing and staying in treatment for both families and individuals. That's a hard thing to wrap your minds around because who doesn't know what's better for their kids than their parents, right? That's generally been a rule you could live by. Mm-hmm. But you have to think about it in the same way of a severe medical issue. If someone has major surgery, people other than the surgeon aren't advising on how to do that, how to get in there. They aren't saying, well, I think you should do it this way. And they're not telling the physical therapist for the next 6 months, like, hey, we know this is what's given us a proven track record to success or best chance for success, but we think you should do it this way. And so, again, this is not parents or the people listening who've made similar decisions. It's totally understandable. But if you can guess from where this story's going, my plan didn't go well. Despite my very real intentions. And my family started to unravel at that point. When my addiction got bad again, at this point, it feels like we've made this effort to try something. Really, we didn't fully engage in the process and what was being offered. And so I think that view was skewed. But at that point, I started to lie and hide things. My mom started to kind of try to obsessively run my life and fix things. My dad started to disengage. I would end up going to treatment a couple more times. This whole time, my family was getting sicker and sicker. My relationships with my siblings, my relationships with my parents. My turmoil of addiction was starting to become the focal point in a negative way of the family. And like a good Southern religious family, they weren't even able to access the love and support of their immediate community. I think because of the shame and probably out of a desire to try to protect my name and reputation. I remember my mom was telling people that I was at a Christian leadership retreat a couple different times I went to rehab. Right? They were in their minds, they were protecting me. What they were really doing was not allowing the truth to come to the surface, was not allowing themselves to be in a place to ask for help. And our family dynamic just continued to implode on itself. And I think I see that happen a lot with families. I think, Rudy, you meet families when they've been going through some type of similar situation, be it for a few months or years. And it's real destructive when the unit turned on itself. Like it really needs to be opened up and loved on and supported by other people, by trained professionals, by other peers in their community, in there or can empathize. The story does have a happy ending, though. There were bad years, and then, unbeknownst to me, through some of my friends, my parents got connected with a great professional, with a guy in this field. I still is a colleague of mine. I talked to him the other day, who just started kind of telling them the truth and helping build some expectations of what this would look like, and kind of reframing maybe their role in my recovery. And let me tell you, stuff changed. I'd gone back to treatment and taken an aftercare recommendation for the first time in my life because my parents held a boundary. The boundary, they were done with me and decide, and they wouldn't take my phone calls. The boundary, Josh, we love you very much, and we are super concerned about you, and it's to be a part of. So we're going to support you 100%, but we're not going to make these decisions for you anymore. And really, we don't even want to be a part of a conversation about it. We have met some professionals that we really trust to do really good work, and we're going to let you have those conversations with them. We want to talk about how your day was, what you want to do with your life, how things are going, but we don't want to manage your recovery. And we want to give you a chance to rebuild trust within our family. And the conversation might have not have been that pretty day one. Right. But we got there.
Yeah.
We got there. And the greatest piece about that, because truth be told, I mentioned that my parents saw a therapist before I went to treatment the first time. There were other professionals at family intensives kind of along that way, along the journey. And not that they didn't add any value, they did. But much like if our loved one went to one day of treatment, it was hard for that stuff to really, that advice, that help to really take root and flourish in my family's life until they got it on a consistent basis. And this was a person they talked to on the phone at least weekly for probably 6 months. And maybe less frequently after that. But it was this consistent coaching, reaffirmation, and that is what I would think my mom would go, that made the biggest difference. Because I think we're all fast forgetters. We forget our own destruction and addiction. Families, I think, forget progress or forget the years that have gone by. Like it's just, we tend to go back to what it was before. Mm-hmm. And really, the focus needs to be in the present on what is now. And so families, you guys, you girls, having someone keep you in the present and helping you kind of consistently along this journey of your own recovery is going to be, I think, the most meaningful thing for you and your loved one. So.
So where Josh and I work, we have a weekly meeting every Thursday, and we have an intention that we set. And I think that it's an intention that we can take throughout our lives, anywhere we go. And it's very simple. We believe in the power of circle. We believe circles are better than rows because we have more to learn from one another on equal ground than one voice speaking alone. We believe our deepest need as human beings is to be fully known and loved. We believe truth without love is harsh. Love without truth is codependent. Therefore, we set our intention to speak both truth and love. If there's one thing that I can leave you with, it's that. It's that you can't work in rows. When we find circles and we find people to support us, we become we end up on an even playing field where knowledge is acquired, change can be made. When we simply stay in rows, we disconnect. We have different rows connecting with different things that are hearing different messages. When we can connect together as a community, as a family, as treatment providers, as your loved one's entire team, because as professionals, there's certain needs that we will never be able to fill for your loved one that you must be a part of. And it's what we want. Being able to engross and embrace you into their care so that this isn't decision making that is solo and alone. Whether it gets to the point like Josh's family was able to have where they had professional support engaging Josh, or if we don't need to go quite that far and we can pull you in. Recovery is not something that occurs in a vacuum.
No.
And the more that you can be involved as guided by the professionals, traditionally, the more helpful it can be. There does come a point in time if you need a little bit of, if you need the boundaries put in place like Josh did, that will be a time. But the more we can have you involved, the more we can give you guidance and work together as a team embracing it, the stronger outcomes tend to be.
Absolutely. Yeah, I just thank you for that, Rudy, and thank you guys for joining us. Whoever sees this, I hope it's a blessing to you. We hope it's a blessing to you. I hope, like Rudy said, we hope that you find your tribe, that you find your network of whether it's therapists or professionals or other families that have been through it, that you find them and you latch onto them and you connect and you lean into that support because you are not alone in this. Mm-hmm. There are millions of people who have recovered from a seemingly hopeless state of mind and body, that being substance use disorder, and there are just as many families that have done their own work, that have come light years in their own journey, and it's totally possible for you. As far as what you can expect from your team, well, the topic of this talk might have been a little misleading, but we wanted you to watch. The truth is, what you can expect is all over the map. Treatment centers may provide 0% of what we talked about here today, or they may provide close to 90. But the truth is, the greatest, most expensive one in the world with the best therapists can't provide all of it. Find some people who know what they're talking about, who care about you, and can connect you to some resources and start to build your team. Start bringing people in. Ask for help. It's the same thing we're going to ask your loved one to do. And it's the same thing we're asking you to do today because it's there and you can have it. Thanks for joining us. Have a good day.
Thanks for showing up.